Congressman Michael Burgess from Texas. He's the chairman of the Energy and Commerce Subcommittee on Health, also a medical doctor. Congressman, always good to have you. Senator Bernie Sanders from Vermont, stiff criticism about this bill as confirmed by the CBO. Here's what he said. I want to give you a chance to respond to it.
Very well.
We can call this legislation whatever we want. You can call it a destroy health care bill. You could call it a tax break for the rich bill, but we should not call it a health care bill.
Your take.
Well, no surprise. I'd probably disagree with the distinguished senator from Vermont. But, Chris, let's look at some important things here. The premiums, as reported by the Congressional Budget Office score, do decrease 4 to 30%, depending upon some calculations. And that is significant because in the first 3 years that the Affordable Care Act has been in place, Department of Health and Human Services just released the figures that the average premium in the individual market, which is what we're talking about, the average premium increase was 107%. In some cases, it tripled. This is what is depriving people of insurance coverage. Now, from a physician's perspective, you know, I really care more about the access to care than the access to coverage. Coverage is important. It's an important part of the equation. But I'm also concerned about people who have coverage who find that their deductibles are so high that they basically don't use their coverage, they don't use their insurance, they postpone care because the policies that they have essentially don't work for them.
I understand.
This has been the whole idea, to try to bring policies and people together, try to bring care and people together, and this is one more step in the process. And then here is a very important point that people conveniently forget. This is not the end of the story. Now, of course, there's the Senate side of the story, and we can talk about that as well. But even after a bill is signed into law, it doesn't stop things. Things are going to continue. The Health Subcommittee is a very active subcommittee. We consider lots of legislation. We're working on a big FDA bill. We just did a markup in subcommittee last week. We'll do a markup in full committee next week. There are things that are going to be happening in the healthcare space continually through this year, next year,
right.
And I would wager for quite some time. A lot of people back home are concerned that I didn't repeal enough of Obamacare, that I left the Independent Payment Advisory Board, for example, is still on the books. Yeah, that's something we're going to have to tackle, and I expect we'll likely have some bipartisan support for that because I've heard Democrats complain about that body as well. There are a number of things that are ahead of us that we can work on together.
Right.
This is just one more step in the process. I, for one, am so grateful now that the folks in the Senate, all the senators who've said that they're so much smarter than House guys and they want to work on this, God bless them. They get it.
Look, I mean, you have a different political dynamic going on in the Senate where they have to be more sensitive, some of these senators, to states where you have a lot of poor people who needed the Medicaid expansion, who are going to be pushed off either by the state or by this financial reality. So they're a little bit more sensitive to that than some of you.
May I speak to that?
Well,
because that was part of the issue as we had the bill in our committee back in March, if you remember that.
Right.
And one of the charges to us was you have 19 Republican senators who are in states that have expanded Medicaid, right. And the reconciliation bill from 2015 was felt to not be fair enough to those states.
Right.
And we worked very hard on trying to make that fair, as well as fair to states like mine that didn't expand Medicaid.
But I mean, you have 20, well, as you know, expansion and not expanding is one of the factors that screwed up the ACA's rollout in terms of.
Then they should have drafted the bill better in the first place.
States that didn't have money, and if you look at the markets where you had premium spikes, very often not taking the Medicaid expansion caused a problem. So it's a little convenient to say that premiums are going up but not discuss why. But I want to talk to you about this bill for a second, Congressman, as a doctor. Because you say, you know, I'm a doctor, I care about patients. I don't understand, please help me. How can you look at this bill and the CBO score and say as a doctor, you feel good that people are going to have more access? You have to know that less people will have access, and these premium reductions that you're trumpeting as a success of this bill go to those who make more money. The less money you make, the less of a premium bump you get, and the more likely it is that your premium will go up. And we're not even talking about the pre-existing condition problem yet.
The premium reductions go to people in the individual market who right now are being pushed out of the market by the ever-increasing
But
premiums.
income is relevant. We have the statistics, and the more money you make, the better off you're going to be with this bill. And I'm not saying that that's right or wrong, but as a doctor, the less money you have, the less chance that you're going to save money with this bill. Does that sound right to you in terms of your oath as a doctor to want to give care to the needy?
Look, the problems that exist in our healthcare system are never and were never going to be fixed by a single bill. That was one of the false premises of Obamacare, that it was going to fix everything, and we had nothing to change after it was passed.
But this is supposed to be the fix. Context matters, Congressman.
This is the first step of a multi-step process.
But what does it make better? If it's better for me, okay, if I didn't get my health care through CNN, thank God, they got a great health benefit package here, I make a lot of money. I'd be okay with this. I'd be okay with it. I like that you're not going to make businesses provide care. It's going to help my friends who have businesses. They're not going to have to spend as much money. That's great. But if I'm struggling, if I'm on the margins, there is a better chance that my premiums will stay flat or go up. There's a chance if I'm on Medicaid that I'm going to lose my care under this bill. There's a good chance that if I have a pre-existing condition, I'll get priced out of coverage. How does that make it better?
Well, you've asked a number of questions, and just since you alluded to your personal situation, I purchased insurance in the individual market on healthcare.gov. I had a health savings account. That went away because the president told me I had junk insurance and I would have to buy a policy now that was sold through the marketplace. It was triple the premium. The deductible went through the roof, and as a consequence, and I speak to many people who are in exactly the same situation, they feel as if they don't have coverage. Why do I have to pay these expensive premiums when I've got an insurance policy that I can't use? So those people also need to have some consideration. Now, on the Medicaid side, there is now going to be a tax credit that will be available to help people purchase insurance. One of the big problems in the Affordable Care Act is every time the premium goes up, someone who's got a subsidized premium, they're good because the subsidy went up as well. But if you earn below 138% of the federal poverty level or above 400% of the federal poverty level, that increase in cost is entirely on you. With the tax credit that will now be available after 2020, that becomes much more, that is moderated for people who are not covered by subsidies. And then the biggest thing for me has always been the individual mandate. How in the world can the federal government mandate that you purchase something and then regulate it under the Commerce Clause?
The Supreme Court ruled on that, Congressman.
I get it.
But this is a broader conversation to have. It's a good start. We're going to have plenty of time to talk about the particulars. And I appreciate you coming on as a doctor and a lawmaker. You're